This leads us to the next segment, a fireside chat on biomedical research and bioethics in Singapore, as well as the future direction and impact it has on Singapore's healthcare system. On the panel, we have, from the Ministry of Health, Associate Professor Kenneth Mak, Director of Medical Services, and Professor Tan Chorh Chuan, Chief Health Scientist. From the BAC, we have retired Chief District Judge Richard Magnus, BAC Chair, as well as Professor Lee Eng Hin, Senior BAC Member and a member of UNESCO's International Bioethics Committee. Moderating the panel will be Associate Professor Roy Joseph, BAC member who is also the Chairman of the National Medical Ethics Committee, as well as Emeritus Consultant in the Department of Neonatology, National University Hospital. Associate Professor Joseph, please.
Thank you, Audrey, for introducing us. Good morning and welcome to this fireside chat on the BAC past, present and future. We aim through this chat to reveal personal perspectives. We hope that these will help to reveal the physical nature of the BAC's vision of empowering our next generation. Exactly 1 year ago, on 17th June 2020, Singaporeans welcomed with joy the further lifting of many of the restrictions imposed about 2 months earlier by the circuit breaker measures. Many will not be aware that it was the carefully reasoned application of ethical principles and values that enabled the imposition and the lifting of restrictions. Bioethics then and will continue to be the basis of our collective survival. Earlier this morning, our DPM, Mr. Heng Swee Keat, exhorted the importance of continued investing in science, cautioned that we need to do so in line with our values, and urged the public, including students, to contribute to this cause. Professor Wolpe built on the idea of values, the joy in ethics, emphasizing that there will always be difference in values. He pointed to the importance of developing a convergence of values and suggested that flexibility in regulations would be of use in developing convergence. The messages from our patron, Dr. Tony Tan, and our Emeritus Advisor and Founding Chairman, Professor Limpin, have shown that determined and diligent study that is grounded on ethical values and principles will indeed lead to socially supported and reputable scientific progress. Our panel will enrich our learning journey with perspectives of the experiences from working within and with the Bioethics Advisory Committee. Panel members, Professor Mak, Professor Tan, Professor Lee, Judge Magnus, thank you for joining us.
Thank you.
And welcome. We have heard about a lot about what the Bioethics Committee has done. Professor Mak, may I put this question to you? What do you see as the key impact of bioethics work in our healthcare system today?
Thank you very much, Roy, for that question. I think it's very important to have ethical biomedical research that allows us to strike a balance between forging an appropriate balance between safeguarding the welfare of research participants, enabling sound research and scientific achievements to be made, within a socially and internationally accepted norm. It allows us also to have confidence knowing that the work we do is in the best interest both of research participants as well as society, and that the outcomes of our research will further benefit society in the different arenas in which these research endeavors are carried out. It also allows us to define the fundamental principles by which it guides our policy making in many different areas. So for example, in the use of data, how it affects the individual who volunteers his data to us, how we inform and obtain informed consent from that individual so that he is fully aware of the governance and the accountability that we exercise with respect to the data he contributes. But because that data has hereditary implications, then ethical sound research provides the basis by which that data is also used to guide how we manage risks and outcomes that apply not just to the individual who contributed the data, but also to future generations as well. And I think that biomedical ethical considerations allows us to set these broad framework and parameters that further benefit us.
Thank you, Professor Mak. As the Director of Medical Services, you are aware of so many issues that occur within our system. What are some of the more what are the more common ethical issues that currently surface in our institutions?
There are several issues that either are on the horizon or actually affecting us today, where research has transited into clinical application with quite significant societal impact. The first of which is pre-implantation genetic testing, which is undertaken in the context of assisted reproductive medicine. Here, we have a clinical service that's providing testing, looking for genetic and chromosomal aberrations or defects in embryos that are tested in the context of an in vitro fertilization program. Couples who are undergoing assisted reproduction can access these services via approved service providers. But there are social and ethical concerns beyond the medical clinical benefits, which includes the possibility of gender selection, the possibility that less socially desirable but non-medical traits are selected out, the possibility that that this affects genetic diversity, it discriminates against those who may have disabilities. And as Chairman, Mr. Magnus had mentioned earlier in his address, the cost of such new technologies can be quite high. And there are concerns that the introduction of such clinical services becomes only accessible by the economically privileged, leading to then inequity of care provided to the community. And these will be some of the ethical concerns for services like this. I mentioned earlier about the impact of collecting data, and we're using the data for a variety of different reasons. We apply artificial intelligence algorithms to derive new insights. We combine that data, collecting digital phenotypes, combining genetic genomic information with traditional clinical and physiological information, hoping to get better insights for risk prognostication and allowing for opportunities for early intervention, either to stave off the onset and development of new disease conditions or to prevent a progression to more severe disease and complications. But as we do this, there comes the need to define ethical use of that data, the responsibility in terms of how confidentiality is still preserved, and the impact, as I mentioned earlier, on future generations is something that we need to consider. There are vulnerabilities every time we collect data because of the need to assure security. The risk of cyber hacks and stealing of data is ever real one. And these become part of the ethical responsibilities we have in terms of safeguarding and being accountable for the use of that data.
Thank you, Professor Mak. You have indeed identified for us, I think, many decades of work which we may have to expedite and deliver much faster. Professor Lee, as a member of the BAC, can you see how the BAC may contribute to the growing list of issues that Professor Mak have just identified for us?
Thank you, Roy, for the question. I think the BAC is confronted with lots of work, and there's work to be done now as well as work to be done in the future. BAC has always been very consultative in the sense that we have a multiracial, multicultural, very diverse society. So whenever we embark on any kind of work that leads to recommendations for Singapore, we will have a very broad consultation with everyone. In addition, we will always look for experts, both locally as well as internationally. And the international experts do give us a lot of insight into how things are done overseas. And as a member of the International Bioethics Committee for UNESCO, I've had the opportunity to meet many of these bioethics experts. And the areas that we are working on actually has a lot of relevance to what Singapore is doing now as well as in the future. For example, pandemic preparedness and so on, which was mentioned earlier before, is one of the areas that the IBC is also working on, but particularly in the area of equitable access to vaccines, which is a huge problem. Protection of future generations has already been mentioned by Professor Mak as well as Mr. Richard Magnus. And one of the areas that BAC is working on now is genome editing or human genome editing. And again, this has a lot of implications because if we're editing the gene for rare diseases, it's quite different from, say, editing genes from germ cells or reproductive cells, in which case then the impact on the future generation is still unknown. So these are huge ethical issues that we have to consider. Another area which was mentioned was the area of AI, robotics, digital health, using algorithms, machine learning, and so on. So we need to look at what is the implication of this on who at the end is responsible. Because, for example, we are using now machine learning to diagnose diseases based on X-rays and pathology, histology, and so on. But there should be someone at the end who is actually responsible for the decisions that are made. And somebody has to take the responsibility, because if we use the analogy of the driverless car, for example, who at the end is responsible if the car gets into an accident? I just want to, I don't want to go through everything, but I think one of the areas that we need to look at for Singapore in the future, and this is something that ethics bodies are now talking about, but not really getting into yet, is the issue of super aging. We have an aging population, and in Japan, they call it super aging because they have lots of people who are over 100 years old. So what is the ethics of that? Thank you.
Thank you, Prof. Lee. You have just added more to our list. Prof. Tan, you spend a lot of time thinking about what we have been doing and what as a country we need to look into the future. As you, and I'm sure you would have identified areas of research that we as a country would be going into. As you think of those areas, what do you see as these areas? Could you name a few areas? And could you suggest what could be the issues, especially the ethical issues, that we might be thinking of when we meet in about 20 years' time for our 40th anniversary celebrations? And this was a question put by Professor Chesterman. Thinking about which way our research goes, what are the types of issues that we would be dealing with or have dealt with in the next 2 decades? Prof. Tan, please.
Thanks very much, Roy. I have had the great privilege of having been associated with the biomedical research program in Singapore since its inception. And we've made strong progress in the past 2 decades. And at the moment now, we are in a position to integrate the different component capabilities we have built to create impact. In other words, to translate research discoveries into better health systems, and also create economic value. Some of the things that we are focusing on now in the biomedical research agenda have been mentioned, but I will just perhaps add a little bit more color by highlighting some of these. One area I think which is quite new, which is going to be the focus of our work in the coming years, is human potential. In other words, what are the things we can learn from biological, genetic, and clinical research that will help us enable babies, children, adults to be able to reach their full potential. In some ways, this is related to their health, because to achieve your full potential, good health is important. And the question is, are we able to do more when during pregnancy, in early childhood, to be able to set individuals off to the best trajectory of health? At the same time, there are some opportunities for us to also improve the ability to learn, to be able to succeed in mastering tasks early, so that will also prepare individuals on a different trajectory for improvement in the future. I think that is an area which is very exciting. It has the potential to create tremendous benefits. It also encompasses a number of ethical dimensions, such as the areas that we go into, whether they intrude into privacy, as well as the equity issues that have been mentioned by DMS and others. So human potential, I think, is an important area that we'll be working on, which we think will have a very important long-term impact for Singapore, but which also will carry with it a variety of complex ethical dimensions. A second area is precision health. And precision health is the ability to take data from very disparate data sets, bring it together to produce insights such as people who are at higher risk of disease or bad outcomes, and also to try to identify the risks for individuals in terms of their propensity for severe disease and the likelihood that they will progress if they already have a disease. So this has tremendous potential. It allows us the opportunity to be much more able to identify at-risk individuals and groups, to be able to develop and to provide interventions that would reduce disease or its severity, and ultimately lead to better health and outcomes. So there's a promise of precision medicine, and that includes really the use of phenotypic clinical and genetic data. But as has been mentioned by many of the previous speakers, this also raises a number of very important ethical issues which need to be addressed upfront so that we are able to maximize the benefits of this precision health thrust while trying to reduce the issues that might be associated with it. And one final area which I might just mention for the future is really what I would call new biotherapeutics. In other words, we're all very familiar with small molecule drugs like Panadol, antibiotics, and so on. We're also familiar with biologics like antibodies. During the pandemic, I think everybody has become very familiar with monoclonal antibodies as a way of treating COVID infection. But the new biotherapeutics includes RNA technologies, DNA technologies, cellular therapies, genetic types of therapies. These will have tremendous applications. They will allow us to tackle diseases that hitherto have been quite resistant to treatment. It will allow, I think, many people to benefit. But as has been highlighted by previous speakers, there are also many new challenges, ethical and also application types of challenges that we'll have to deal with as we try to progress work in the new biotherapeutics. So many exciting things, I think, on the horizon, but also, I think, many issues that we'll have to work along the way. Thanks.
Thank you, Prof Tan. Those are indeed very intriguing areas, some of which we have a sense of, but it really means that there is a lot of work. So which means I can now turn to our chairperson, Judge Magnus. There's a lot for the BAC to do.
Yes.
What do you see may be new ways in which we could function to maybe in a more expeditious manner address these issues?
Yes. Thank you for that, Roy. I think we have got a very robust method of consultation, I think at the moment, both locally as well as internationally. So I think we will keep to that tradition. But in addition to that, and I think we need to continue to have intensive one-to-one conversations with the experts, not only internally but also locally. The BAC as a whole, I think, would need to be able to have very extensive conversation. I think we need to develop a very high level of scientific literacy. The BAC members now comprise lawyers, researchers, medical professionals, psychologists, psychiatrists, as well as members of the community. We may want to be able to consider about expanding the composition of the BAC in order to deal with some of these issues that the DMS and Professor Tan Chorh Chuan had just mentioned. To be able to grasp what the issues are, what the science is in this particular area, and then to be able for us to formulate in some of these matters that concerns the issue of bioethics. We now have international panel of advisors. They're currently based on the selected on the basis of experts for certain specific areas. But if you look at what DMS and Professor Tan had mentioned, a lot of these developments include an application and appreciation of science across the various areas. So we will need to develop also a panel for ourselves. They have got similar kind of an expertise in this area. So I think there is, in other words, we need to go deeper, we need to go broader, and we need to go cleverer in some of these aspects.
Thank you. Thank you so much, sir. We have one question in the sense that All right, it's a current ethical issue, and that is with several approved COVID vaccines already available on the scene and locally. How may IRBs approach applications for doing research on a new vaccine? And I'd like to throw this open to all the members of the panel. Would any of you like to?
Yeah, thanks, Roy. Maybe I'll just start off first by saying that we have to take a long-term view. And while it's true we have very effective vaccines today, we have to continue to stimulate and support the development of new technology platforms that could produce vaccines even faster and possibly with greater efficacy, that are able to do new things. For example, address the threat of variants, or maybe develop vaccines that are capable of addressing a class of viruses rather than just a specific one. So these are the types of advances that we will need beyond the current first generation of vaccines. There are clearly, as the question implies, a variety of ethical issues. I think in the basic research stage, the preclinical testing stage, these may not be as salient. But once we come into human studies, of course, these will come to the fore. But I do think that carried out under properly controlled and regulated conditions, these should be allowed to proceed so that we continue to build up our body of knowledge about even more effective ways of dealing with this particular virus, but also learn along the way as to how we could develop better technologies that might be applicable for other types of viruses in the future, and will allow us to be able to develop and manufacture vaccines even faster in the next outbreak. Thanks.
Thank you. Anybody else? Yes, please.
Yeah, I'll perhaps contribute a few additional comments to what Chorh Chuan has very nicely articulated. Chorh Chuan has mentioned about the ongoing relevance of research in the setting of a pandemic. And despite the fact that a lot of research has already been done to identify promising vaccine candidates, several of which have come to commercial application as well, there remains relevance in identifying new vaccine candidates that may take us one additional bound, whether it's in dealing with new and emerging viral variants, dealing with the issue of waning immune protection from existing vaccinations. But the research work that continues is not only in the vaccination space. There is still a need to identify new and promising diagnostics, therapeutics that lessen the pain associated with adverse outcomes and death from COVID-19 infection or other similar contagious diseases. But what is of relevance to me as the Director of Medical Services in Singapore is the need to continue to adhere to ethical frameworks, notwithstanding the need to expedite research in the setting of a pandemic. The traditional governance frameworks that we have, incorporating institution research boards, have a certain pace to scrutiny, evaluation, careful deliberation, and in certain settings where there is an existing dire public health emergent need for some research endeavors to be expedited, there sometimes is a requirement for us to think of expedited approval mechanisms and pathways to allow for diagnostic tests, studies to be implemented, therapeutics to be studied, and vaccines to be introduced. And this is the basis for the expedited vaccine approvals given for some vaccines in different countries. But notwithstanding these expedited approval mechanisms, the ethical safeguards still remain relevant. We have to look carefully at the risk and benefits associated with these new tests, treatments, and vaccinations. And we have to deliver a decision that creates that balance between the benefits both to individual patients and to society, with careful regard to the potential risk, both defined and yet to be defined, particularly with the use of novel products. And that ethical responsibility will not diminish as we deal with these emergent threats.
Thank you, Professor Mak. Professor Lee, would you like to add anything more to what Prof Tan and Prof Mak have said?
I think both our esteemed colleagues on the panel have said almost about everything. I suppose the only thing I could add from a more basic point of view is that these studies have to go through the various phases. So the IRB approval may not be a total thing. It has to be based on the safety, efficacy in the phase 1, 2, and the early phase 3, and then so on. So I think it's very difficult to just ask an IRB to approve the whole thing. Thank you.
Thank you.
Yeah,
Mr. Magnus,
I thought
what
Joe,
would you like to add to this?
What I would like to see, of course, is I think the IRD already is adopting quite a robust process. And I think that should not go away. Secondly, as Kenneth and Chorh Chuan had mentioned, is that bioethical compliance becomes critical in this particular area. I think we talk about proportionality, we talk about solidarity, of course the equity part I think becomes quite relevant. So I think whilst we are doing trials in regard to new COVID-19 vaccines, moving from first generation and continuing that particular road that we take away, I think the ethical principles continue to remain steadfast. And I would, as BAC, I would just encourage that this need to be really adhered to in a very strict way by the IRDs. In other words, we need to be socially conscious, socially responsible, socially sensitive, to use your words, in doing the research.
Thank you so much. Robust, responsible, reliable, so all key words that we have heard today. It's now time to bring to an end the stimulating fireside chat. And on behalf of the panel, we thank you, the audience, for your presence and contributions. We hope that your awareness of the importance of bioethics has been raised, and you are stimulated to contribute in this area. We regret that we are unable to address all your questions. We shall devise the means to do so. Panel members, Professors Mak, Professor Tan, Professor Lee, and Judge Magnus, thank you for sharing from the richness of your experiences and giving of your precious time. Members of the operations and administration team, well done, congratulations, and thank you. Have a good day and stay safe. I believe many fires have been ignited and kindled. May I suggest that you initiate your own fireside chats on bioethical issues. And on that note, thank you very much.
Thank you.
Bye-bye.
Thank you to everyone who submitted questions, and a big thank you to our panel, Associate Professor Mak, Professor Tan, Mr. Magnus, Professor Lee, and Associate Professor Joseph for a very fruitful discussion. I have certainly learned a lot. We will now take a short break, and we will be back at 11:50 a.m. for our second panel discussion, The Importance of Religious Perspectives and Interfaith Dialogue for Bioethics in Singapore. We'll see you then.
What I would like to see, of course, is I think the IRD already is adopting quite a robust process. And I think that should not go away. Secondly, as Kenneth and Chorh Chuan had mentioned, is that bioethical compliance becomes critical in this particular area. I think we talk about proportionality, we talk about solidarity, of course the equity part I think becomes quite relevant. So I think whilst we are doing trials in regard to new COVID-19 vaccines, moving from first generation and continuing that particular road that we take away, I think the ethical principles continue to remain steadfast. And I would, as BAC, I would just encourage that this need to be really adhered to in a very strict way by the IRDs. In other words, we need to be socially conscious, socially responsible, socially sensitive, to use your words, in doing the research.
Thank you so much. Robust, responsible, reliable, so all key words that we have heard today. It's now time to bring to an end the stimulating fireside chat. And on behalf of the panel, we thank you, the audience, for your presence and contributions. We hope that your awareness of the importance of bioethics has been raised, and you are stimulated to contribute in this area. We regret that we are unable to address all your questions. We shall devise the means to do so. Panel members, Professors Mak, Professor Tan, Professor Lee, and Judge Magnus, thank you for sharing from the richness of your experiences and giving of your precious time. Members of the operations and administration team, well done, congratulations, and thank you. Have a good day and stay safe. I believe many fires have been ignited and kindled. May I suggest that you initiate your own fireside chats on bioethical issues. And on that note, thank you very much.
Thank you.
Bye-bye.